Hello, everyone. Welcome to Greenbelt Career Institute. This is our CMT training program, Certified Medication Technician Training Program. Some people call it MedTech. This program is about training students to understand how to administer medication safely and properly. Okay, this is your training manual. You will open and follow along as we present the program. The manual is yours to keep. Okay, let's go straight to the introduction. You have our information on the cover pages, but let's go straight to the introduction. Okay, let's talk about the introduction. Okay, here's the introduction. Again, the purpose of this training is to prepare you to work in the assisted living, giving medication in group homes, in private homes. The CMT does not work in the hospital and does not work in the nursing homes because they have registered nurses and LPNs working there. The Maryland Board of Nursing and the Department of Health, they put together this training manual to cover the regulations, and you are supposed to work under the supervision of a registered nurse who will be your nurse manager, supervisor, delegating nurse. The registered nurse, your delegating nurse, will be visiting your home at minimum every 45 days or as needed. Could be more than that, could be less than that, And this is who you communicate any problem to and keep informed as to what's going on in the home. Okay, the training helps you to protect the health and well-being of the residents. Okay, so let's go straight to chapter 1. Okay, here's chapter 1. So you can open to chapter 1. Okay, what are we covering in chapter 1? We're going to identify 4 reasons why medications are used, primary reasons and the rules, regulations, policies, and guidelines for giving medication, 2 basic principles you need to know to give medication safely, 4 basic rules regarding medication administration, 8 components of medication administration process, practices that assist in protecting individual rights, and list 2 practices that strip individuals of their dignity. All right. So, what are the 4 basic reasons why medications are given? As a medtech, you have to know why you're giving the medication. Why is the resident on that medication? You need to know. What does the medication do? What are the side effects? Okay. We take medication ourselves, and when we take medication to prevent illness. We take medication to control or to stop illness. We reduce symptoms, maybe you're coughing and sneezing because of flu that you have. So you could take cough medicine to reduce the symptoms of the coughing. We take medications to manage illness. For example, people take blood pressure medication to keep the blood pressure at a normal range and to prevent it from getting worse. So, very important that you know why you're giving the medication that you're giving. So you must know how to give medication safely to people under your care in the assisted living. Okay, you must give medication and understand the medication and what it's used for. You must know the drug interactions and possible, you must know the drug actions and possible negative interaction. What is negative interaction? Negative interaction is when two or more medications are prescribed for the same person and then the medications don't get along. To put it in a layman's term, one medication is making the other medication not to work properly. That's negative medication interaction. You have to know how to give medication. You have to know what to observe after you give medication, and so on. So you can read through the rest of those. Again, only those that are licensed or trained to give medication can give medication. For example, CNAs cannot give medication. Only registered nurses, case manager, delegating nurses can be your supervisor, can be your delegating nurse, can give you authorization to give medication to a resident. Again, no medication can be given without the prescription of a doctor. When your delegating nurse gives you an order to give medication, usually it will only be over-the-counter medication. That's considered being ordered by the doctor. So even when over-the-counter medications are given, they still must have the doctor's prescription before you can give it. So let me give you an example. Your resident Jack Jones call home and tell the mother that he's having a headache. The mother goes to CVS and buy a brand new pack of Tylenol and brings it to the home. You cannot use it. Why? Because it was not prescribed by the doctor, even though it's over the counter. What you're supposed to do is to call your charge nurse and get an order to give the Tylenol. Then you call the pharmacy and obtain the Tylenol prescription. They'll deliver the same Tylenol to you. So whatever we're giving the resident must be ordered by the doctor and must be delivered, must come from the pharmacy that we have contract with. What are your responsibilities when administering medication? Okay. Well, after you give medication, you're going to observe for changes in physical condition and behavior. You will report changes to the right person. In this case, you will report to your delegating nurse. Okay. You will assist family members. You will assist when the resident needs to visit the doctor for a doctor's appointment. You will communicate with the pharmacies to obtain prescription, both new orders and refills. You will store medication safely. One thing about storing medication safely, if medication needs to be stored in the refrigerator, and you'll always see that the pharmacy put a sticker on the bottle or that says refrigerate, or the bottle might say store at room temperature. So you know, if it says store at room temperature, it doesn't go in the fridge. If it does need to go in the fridge, the medication needs to be in a box in the fridge, that is in a locked box in the fridge. That way to prevent residents from mistakenly thinking that the medication is juice and they just pour it into a cup and drink it. When you give medication, you have to give medication correctly using the 6 rights. You have to make sure it's the right person, make sure it's the right medication, make sure it's the right dosage, make sure it's the right route, make sure it's the right time, and make sure it's the right documentation. After you give medication, you don't just walk away, because some residents, when you give them medication and then you walk away, they will spit it out, and you think they took the medication. If the medication was, say, for example, the medication was for seizure, what do you think will happen if they spit the medication out? They will start having seizure later on. So when you give them medication, you ask them to open their mouth. Say, Mr. Jones, please open your mouth. Did you take your medication? Make sure you swallow it. Lift your tongue up. Give them additional water to drink, or pudding or apple juice, whatever they prefer to use to help swallow the medication better. You have to respect their rights. Yes, some of them have disability, both mental and physical disability. However, we cannot force them to take their medication. They are not in a psychiatric institution. That is their home, and they have rights. Okay. So let's move on to Chapter 1, Section 2. We're going to talk about effects of medication. We're going to talk about drug interactions. We're going to talk about the difference between sign and a symptom. We're going to give examples of signs, example of symptoms, difference between verbal and non-verbal behavior, side effects of taking medications, principles of good observations. We're going to talk about physical changes you should know when administering medication, and changes in behaviors you should know also when giving medication. So let's start with identifying effects of medication. So there are three main effects of medication when medication are given. The first one is desired effect. Desired effects, just like the word says, desired. For example, I have a headache. You give me Tylenol for my headache, and the headache goes away. Well, that's the desired effect. The next one is negative effects, undesirable or unwanted effects. So that will be that I have a headache, you give me Tylenol, and I start having rashes, or I start having diarrhea. So those will be considered negative effects or unwanted side effects. No apparent effects. The third one. No apparent effect occurs when I have a headache, you give me Tylenol, and nothing happens. Could be that the strength is not strong enough for me, or I need to take a different type of medication because that medication is just not working for me at all. Okay. There is other effects, for example, addiction. So addiction is when someone has been taking a particular medication for a while and they now become addicted to it. So whether they have pain or not, they will tell you that if they don't take the medication, they're going to start shaking and they're going to start sweating. So a lot of people get addicted to the medication, and that's not a good thing. Then you have tolerance. Tolerance is when someone has been taking medication for a while. It was working before, but then all of a sudden it doesn't work anymore. So the body builds tolerance to that medication or to that dose. That means they will need to increase the dose or switch to a different type of medication. Okay. So now here we're going to talk about your responsibility to observe for these negative or side effects of medication. It is in your best interest to always look up the medication that you're giving and try to understand the side effects of those medications so that you know what to look for. Or when something happens to the resident, you know that it's from the side effect of the medication that they are taking. It could be drowsiness if they're taking allergy medications, stomach upset if they're taking aspirin, dizziness if they're taking blood pressure medication. Because the blood pressure medication could actually lower the blood pressure to the point where the person starts having dizziness. Okay, so let's move on. Next, we're going to talk about signs and symptoms. So sign, changes that you see in an individual's appearance or behavior, they can be seen or heard or felt or smelt. You can see that somebody has a fever. You can feel their body is warm. You can also take their temperature to see that the thermometer gives you a reading of 100 or higher. So you see or hear an individual crying or moaning. The skin is warm or cold. You see that they have vomited or they have diarrhea. You hear an individual with slurred speech. Okay, so those are signs. Now, symptoms, changes that you cannot see but are experienced by the individual and they report to you. These are also called subjective signs. The other signs that you can see or measure are called objective signs. So, for example, examples of symptoms or subjective signs: pain, itching, dizziness, weakness, nausea, loss of appetite. You cannot see those, only when they tell you that they have these invisible signs. Then you know that you just have to take their word for it. Changes in physical condition. It is your duty to observe constantly changes in their physical condition. Okay. Changes in their weight. The urinary pattern have changed. They used to pee maybe 4 or 5 times a day. All of a sudden, they only pee once or twice. They are constipated. Loss of appetite. Their balance when they're walking is shaky. They're not able to dress or groom themselves anymore. They're not able to feed, or they don't eat much. So what do? You have to report these changes to your charge nurse. Changes in behavior. Okay. These are behaviors such as their emotional states. Maybe they all of a sudden start emotional outbursts, yelling and screaming or crying. The way that they sleep, they used to sleep well before. All of a sudden, they have difficulty falling asleep. Level of activity changes. They are not participating in activities anymore. The way they communicate has changed, or they don't socialize with others. These are all behavioral changes that you should report. Others include drowsiness, increased irritability, pacing, that's walking up and down the hallway. Some of them trying to open the door, they will tell you they want to go home or get out of here, things like that. Those are changes in behavior. We are still in chapter 1. This is section 3 now, reporting and recording changes. Okay, so this chapter here, we're going to talk about your responsibility as a medication technician to report changes. We're going to talk about 3 categories of changes that must be reported. We're going to talk about when and who you report to and how an emergency medical condition should be reported. We're going to talk about conditions that are always considered emergency, a medical emergency, which requires 911. Okay, so you have to separate those from non-emergency, that is not 911 situation. Physical changes, behavioral changes that are considered non-emergency. Okay, we're going to talk about the 3 essential components in documenting physical and behavioral changes. State where emergency medical numbers are posted, usually is on the fridge. Given a situation of an individual's behavior changes, you can write a report of the situation, what happened, when, to whom, and how. Basically an incident report. Okay. So we talk about all of those. And so here, let's talk about what to report. 3 main categories of changes in an individual that must be reported. The first one is emergency condition. Well, emergency is defined as anything that is life-threatening. Somebody's bleeding to death, somebody's unconscious. That's where your CPR and first aid knowledge comes in. You have to know what to do. Of course, you know that anything emergency, it's 911. So somebody have an accident, there's no breathing, like I said, there's no pulse. Somebody's having a seizure that has lasted for more than 5 minutes. Usually seizures last between 2 to 3 minutes and they stop. But if someone is having seizure for the first time, or they normally have seizure, but this time the seizure have lasted longer than 5 minutes, that's a 911 situation, because it's now life-threatening. Behavior that are dangerous to the person or other people. For example, a resident picks up a knife and said, "I'm gonna kill myself," or "I'm gonna stab you." That's a 911 situation. So remember, 911 involves police, fire, and ambulance. So when you make the call, all 3 branches of the emergency, they're listening to the call. If you're saying that someone has a knife, then police will be there right away. If you're saying that somebody's unconscious, the ambulance, sometimes all 3 of them will come. You see, the police will come, ambulance will come, and the fire truck will come, depending on the situation. You have somebody with a sudden numbness or slurred speech. This is a sign that the person is about to have a heart attack or have a stroke. So you have to be careful to observe those signs. Sudden onset of severe headache, chest pain, or they have difficulty breathing, respiratory distress. So these are in the category of emergency. And the first thing you do is, you already know you have a problem, you call 911. When you call 911, you will start first aid or CPR, depending on the situation. If somebody's bleeding to death, you need to try to stop the bleeding by applying pressure. Put on gloves, and you can use a cloth, a towel, and apply pressure to the area. If somebody's unconscious, they're not breathing, and there's no pulse, you're gonna, once you call 911, you're gonna start CPR. You continue CPR or whatever first aid measures you're doing until 911 arrives. When they arrive and take over the situation, then you call your delegating nurse. After you call your delegating nurse, then you write a report about the incidents that happened. So that's how you report emergency. So now let's talk about non-emergency. Well, non-emergency is everything else that is not an emergency, but it's a medical problem. Somebody is coughing, somebody throw up, somebody have a headache, somebody has a fever, somebody have a minor cut. Those are all in the category of non-emergency medical condition, and that you will report to your delegating nurse immediately. And then you will document the reports in the progress note. The third category of reporting is other physical and behavioral changes that requires notification and documentation. This will be, somebody have lost weight. You will call your delegating nurse and make a report. Somebody's behavior has changed. So you will report those as well. These are not as serious or as... So this is like a chart to kind of guide you as to what to report and how to report it. So you can go through that. But generally, once a situation is life-threatening, that's 911. It's not life-threatening, you call your charge nurse. It's like a physical category, then you call your charge nurse as well. So let's go to we're still in chapter 1, section 4, visiting the healthcare professional. This is when you have to take your residents to the doctor's office. Could be the primary doctor, could be a specialist like a dentist, a cardiologist, a podiatrist. So what you would do is, before we get there, let's talk about the objectives in this section here. So the location where the individual's complete health record is kept, you have to know where to find the medical record of the resident, because you have to take copies to the doctor. Six information that you must take to the doctor when you're going on a doctor's visit. We're going to discuss 2 ways to encourage a resident to participate during the doctor's visit. We're going to talk about 7 frequently asked questions, which may be asked when you are at the doctor's office. You can ask the doctor questions, especially if you don't understand the prescription. Do not bring that prescription back to the house and find out you don't understand what the doctor wrote. It's very difficult trying to get in touch with them on the phone when you're not there in person. So you want to look at the prescription before you leave the office, the doctor's office. 9 information items that is found on the prescription form describe the difference between reorder and a refill. Okay, so let's go into some details. So we understand that there are different reasons why you or a family member may assist an individual with a visit to the doctor or nurse practitioner. Again, you're the one accompanying the individual to the doctor's office, and you should know why the person is visiting the doctor that day. So you must have already know that they have a dental problem, or their blood sugar has gone up, or they're not sleeping. So don't show up at the doctor's office and the doctor asks, well, why, what's the purpose of the visit? And you don't know. Okay. What information to take to the doctor? What information to obtain from the doctor? what to do with the information that you obtain. Okay, so information that you're going to take to the doctor whenever you're going to the doctor's appointment. The history of their medication and their allergies. So you're going to make a copy of all their prescription and their medical information. Okay, and you're going to make a copy of their dietary information. You're going to make a copy of the list of all medications that they're on. We already talked about any kind of allergies that they have. You're going to take with you information about their diet, especially if they're on a special diet. You're going to write down things that has been going on with them. That's written observations. You're going to take their health insurance card so that the doctor can get paid. Okay. Any previous lab that was done or visits. So those are the things that you take when you're taking a resident to the doctor's office for an appointment. So next we're going to talk about encouraging individuals to participate in their health care during their visit. So you're going to encourage the resident, let's say the day before the appointment, you go to, let's say the resident's name is Jack Jones. You're going to say, Mr. Jones, okay, so tomorrow, we're going to the doctor's appointment. Remember all the things that you've been complaining about that's been happening to you. You can't eat well, you can't sleep, you're having pain, you're having this. So let's sit down and make a list so that you remember to tell him all that when you see him tomorrow. So that's how you can help an individual participate when they're going for a doctor's visit. PMOF. So now we're going to talk about information that you need to get from the doctor. After the doctor's visit, you are going to take some information back to the house. The physician medication order form, PMOF, must be completed and signed each time a new prescription is ordered. So if there's a doctor's order, if there's a new prescription, they're going to give you a new prescription to take home. Now, if prescriptions are required, a physician must write prescription that matches what is written on the doctor's form. Name of the medication, dose, the frequency, the method to give the medication, and the purpose of the medication. You must have these 5 items on every doctor's order. What is the name of the medication? Spelled out, written clearly. Now, a lot of doctors have special handwriting. They are the smartest people in the world, but their handwritings are not always the best. So sometimes, as a nurse, I used to sit next to the doctor when they come to see the resident, the patient. As they write a prescription, I read it. I make sure I understand it. If I don't understand it, I'll say, doctor, please, what is this word here? Or what is this spelling here? So that he can clarify it before he leaves. So understand the dosage, understand the frequency, which means how many times a day, or how often are we going to give the medication when. What method are we giving it? Is it by mouth, on the skin, in the nose, in the rectum? And very important to know why the medication is being prescribed. Okay. Is there a stop date for the medication? For example, if doctor says take amoxicillin 500 milligrams 4 times a day for 7 days, then there's a stop date for that because it's only for 7 days. The 7th day is your stop day. Reporting guidelines. Does the doctor want a follow-up visit? Is there any information that the doctor wants to be sent back to him on a regular basis? Sometimes doctor wants to know, they want to track, let's say, blood pressure. What is the next 1 week? I want you to fax me the daily blood pressure. Check blood pressure every day for 1 week and then send that to me. Or it could be blood sugar. So just check and see if there's any special instruction that the doctor wants. Of course, you're going to make sure the doctor's name and address is there and their phone number, and they have signed the prescription. Okay. So next we're going to go to important questions to ask the doctor during the visit. Don't be afraid to ask the doctor questions. It's better you ask. It doesn't matter how stupid you think the question is. Ask it anyway. It's better to be safe than sorry. So you can ask the doctor the purpose of the medication. I mean, you can always look it up, but it's better for the doctor to tell you. How will you know that the medication is working? How much time should it take before the desired effect is achieved? What are the negative effects to watch for? Are there potential drug interactions? What are the specific instructions for taking the medication? For example, take with food, or take in an empty stomach, or give at night. You understand? Or avoid sunlight. It depends on the medication. Are there any special lab tests monitoring? For example, somebody who's on Dilantin or Tegretol for seizure will need to have the therapeutic level monitored. So that means the blood work will be done to check, to make sure that the level of the medication in the blood is within the normal range to prevent the seizure. Then the doctor will give you the schedule of when to do the lab work. Okay. What should you do if the individual refuses to take the medication? These are all questions that you can ask the doctor. Again, it only makes you smarter by having all this information. Information found on a prescription. So let's go to a typical prescription form. So when the doctor writes a prescription, you know very well that the person's name is going to be there. You know, the doctor's name and the patient's name, the dates of the prescription, the generic or the brand name of the medication, the name of the medication, okay? The route or method the medication should be taken, the dose, we talked about this before, the amount of medication in the container or the amount that the pharmacist should supply at once. Sometimes the doctor will say dispense 30. That means give 30 pills. So there are some information in the prescription for the pharmacy, and then information for the nurses. Where are we? The dose of the route. We talked about the routes, the dose, the amount of medication. How often should medication be administered? Like twice a day, 4 times a day, or once a day? What's the number of refills? How many times can you get the medication resupplied by the pharmacy before you need a new doctor's prescription? The doctor's signature, the address and phone number must be on the medication, on the prescription. And this is important because when you go to the pharmacy to fill the prescription, if the pharmacy has a question for the doctor, they can call the doctor right there. And all this information are found on the doctor's prescription pad. Okay. So brand name is also known as a chemical name. For example, you'll see Tylenol and then in bracket acetaminophen. So Tylenol is the brand name. Acetaminophen is the generic or chemical name. Okay. So let's move on to another section here. The first letter of a brand name is always in capital letter. and then there's an R symbol, just to tell you that that name belongs to a particular company. No other company can call their pain medication Tylenol. They can call it acetaminophen. Other companies can make the same medication with with the same generic composition, but they have to call it something else, not Tylenol. So that's what that means when you have trade names. You have Aleve, Motrin, aspirin, all of that. So let's talk about a refill. So a refill versus a reorder. Refill, so you have your original prescription. The doctor says refill times 2. Typically, doctors write prescriptions for 90 days, but the pharmacy can only supply 30 days at once. They cannot supply 90 days, 3 months supply at one time. And the reason for that is because what if the doctor changes the medication after a couple of weeks, or the person is admitted to the hospital? Then all that medication is going to be wasted. So they supply 30 days at a time. So now the order says refill times 2. Towards the end of the 30 days, let's say day 25, it's time to contact the pharmacy to send you your first refill, which will take you to the end of the second month, the end of 60 days. So again, as that 60th day is approaching, say around day 55, it's time to get your second and final refill, which will take you to 90 days. Now, you now have to be careful. As you're approaching the end of the 90 days, you don't have any refill left with the pharmacy. The pharmacy will not supply you the medication anymore because your prescription has expired. So you must start early, let's say around day 75 or so. Don't wait until the 90th day to start looking for the doctor to write a new prescription. So you want to remind the doctor weeks ahead of time to write a renewal for the prescription before you run out. We're gonna go to section 5 here. In section 5, we want to talk about the 12 components of a pharmacy label, to understand that, and state how you would determine if the medication order form and the pharmacy label agree. This is kind of doing your double check, triple check. So you're checking to see that the doctor's order matches what pharmacy supplied you, which they call pharmacy label, the label that goes on the pack of the medication. We're going to go over that. You're going to describe how to verify that you have received the right medication from the pharmacy, and state 3 types of medication packaging, because they send medication in different ways. Okay, let's go into details. Information to get from the pharmacy. So when a pharmacy sends your prescription in, I'm sure you have seen this before. Okay, the pharmacy will give you the medication in a container that will have the pharmacy label on it. It could be a package, a pack that have individual wrapping. It could be in a bottle. It depends on the type of medication. They're going to have a sticker on it, a label on it, a big label that will have 12 parts to it. Okay, you're going to have the name of the pharmacy, their address, and their phone number. The prescription number, the date the prescription was filled, the individual's name, the patient's name, or the resident's name, the name of the medication. Sometimes it will be just the brand name, or sometimes it's just the generic name. But most of the time they put both names there. They're going to put the brand name, let's say Tylenol, and then in brackets they will put acetaminophen, the generic name. The dosage that you're supposed to give, the directions, how to give the medication. For example, take one tablet, twice a day. The quantity that is being supplied to you, maybe it's 30 pills. It could be 60 pills. It could be 90 pills, depending on how many you're using per day. But they will not give you more than 1 month's supply. Any special instruction, for example, take with food or store in the refrigerator, things like that. The name of the doctor that prescribed the medication. So you're going to have Dr. Smith, Dr. John Smith, for example. If that's the prescribing doctor, that name will be on that label as well. Then the number of refills. How many times can you go back to the pharmacy and get a supply without going to the pharmacy? Okay. The expiration date of the medication. So you have the medication, the life of the medication. Maybe the medication can be used for up to 5 years. So you will see the date the medication expires. Okay, so you can see an example here of a typical pharmacy prescription. You see the name of the pharmacy, super pharmacy, and their address. You see the phone number, and then the medication, the prescription number there. The name of the patient, Louis Scott. The dates, the prescription, the name of the medication, the dosage, the quantity that is supplied is 24. And the instruction there, the direction, take 1 capsule by mouth 4 times a day. The doctor is Dr. Donald Berry. There is no refill. Refill is 0 for this prescription. The expiration date, they should have had like maybe January 10, 2005 or something. The medication can't expire the same day that it was issued. So that's a little bit of an error there. So all of this information will be found on the prescription. Okay. So let's move on to the next section. Here is like a sample manufacturer's label. So you see pain reliever, in the front Tylenol, seal with printed foil on the cap for your protection. So they will have something like this, and then they will tell you medication expires, the expiration date of the medication. That's the date you cannot take the medication anymore because the medication is not good. If the order is if you're still supposed to be taking the medication, then you need to let the pharmacy know that the medication that they sent has expired. Then they will send you the good medication. This section here is very important, so please pay attention. When you receive the prescription from the pharmacy, you already know what the doctor ordered. You must check to make sure the pharmacy sent you the same thing that the doctor ordered. You don't want to make the mistake of doctor prescribed one thing, the pharmacy sent you a different thing. this has happened many times. Medication errors kill lots of people in the US, all over the world, every year. And these are errors that should have been prevented. A common example is doctor orders amoxicillin 500 milligrams. The pharmacy sent in ampicillin 500 milligrams. You can see how that error happened because the names are similar. Amoxicillin, ampicillin, they are both saline. They are both 500 milligrams. And someone can just easily receive it from the driver of the pharmacy and then start giving it. So when the pharmacy hands you the medication container, you must check to see that what the doctor wrote and what they have supplied matches exactly. Now there are some situations where the pharmacy can change something, but they cannot change the name of the medication unless they call the doctor and say, oh, this medication that you ordered will have a negative interaction with another medication the person is taking. Then the doctor could change the prescription, but in that case, the doctor will let you know as well. But things that they can change, an example could be, let's say the doctor ordered Tegretol 200 milligrams per tablet. Give one tablet by mouth 4 times a day. But the pharmacy doesn't have 200 milligrams per tablet in stock. They have, let's assume that the medication also come in 100 milligrams. In which case, they now send you 100 milligrams and change the direction from take one tablet 4 times a day. They change it to take 2 tablets 4 times a day. That is still the same dosage the doctor ordered. So they just don't have the one that comes one pill that equals 200 milligrams. They have the one pill that is 100 milligrams, so they now double it up. So when you give 2 of it, you have that equals the same 200 milligrams the doctor wanted per dose. Now, the one thing that you must make sure, if you had already prepared the MAR, and the MAR already have 200 milligrams, take 1 tablet, and pharmacy supplied you 100 milligrams, take 2 tablets, you must change the MAR. You put a line across it. Sorry, put a line across the entire prescription and rewrite the whole prescription below on your MAR. We're going to talk about MAR later. So you're going to rewrite the prescription that matches what the pharmacy have sent. The name of the medication is still the same. The dose the doctor wants to be given is still the same, still 200 milligrams. The only difference now is you're now saying 100 milligrams, take 2 tablets. That way, you don't have a problem where the MAR says, if you don't change it, right? If you leave it alone, your MAR will say 200 milligrams, take 1. But the pharmacy label will say 100 milligrams, take 2. That's a potential med error. Okay, so let's move on to the next section here. We're going to talk about types of medication packaging. Medication comes in bottle, as you've seen. You have unit doses. You have blister packs or bingo packs. Those are the packs that has a bubble, like plastic bubbles, where you can see the single pills in the bubble, and then you just punch the one or two, depending on how many you're giving. You can just punch the hole, and then the pill will come out in the back into your medication cup. Okay, that's packaging. So let's go. Let's pause now and take a break, and then we're gonna come back with chapter 2.